Hi, everyone. Welcome. Welcome to a discussion about the relationship between plant medicines and the healing of trauma. Lovely to have you here. I have my partner in life and business, Laura Shapiro, here. Say hi, Laura.
Hi, nice to meet everyone.
We're going to focus this conversation today on the two plants that we know best. We're going to talk about ayahuasca and we're going to talk about ibogaine. Not only because it's the plants that we know best, but also because they are the plants that I think have the most significant promise and effect on the sort of the healing or the releasing of trauma. We live in a day and age where we're really understanding a tremendous more about how trauma impacts the body, and the mind and the spirit even. And with that understanding from a scientific lens, it's also helped us to understand what the shamanic traditions have known for centuries, that the plant medicines are so incredibly helpful at helping us to heal trauma. I'm going to talk about what I mean by that here in a second. I have 20 some years of experience with ayahuasca. Laura has almost 20 years experience with ibogaine. Both of us are alive because these medicines came into our world and helped us to resolve trauma. And so we're really honored to share some of that information with all of you, because we deserve to know that there are outlets available to help us to move through the crazy world that we live in and the things that happen. And so before I dive into the details around ayahuasca, I just want to share in a very general sense what we know about trauma now. There's a book that most of you probably know called Body Keeps the Score, which is kind of the Bible, the modern day Bible around understanding the impact of trauma on the body. It's written by Bessel van der Kolk. He's one of the foremost authorities on PTSD and really has helped to give language to what's happening physiologically and emotionally speaking when we go through trauma. And the core of that is that we now know that trauma doesn't just get stored in an emotional sense, it gets stuck in the body and it has a direct impact on the brain. And I think one of the things that is most striking about our current understanding of trauma is that the way we relive traumatic events, it's as if it's happening in the present moment, that it's not a past event that we're remembering and feeling a trauma as a result. The way that it impacts the brain, it makes us feel as though it's happening in the present moment, which is why it just defies logic and reason, really, and can feel like there is imminent danger in the moment. Even when there's not, the trauma makes us feel as though it is. And what's significant about that with plant medicines is plant medicines deal with us in the present moment, what we're feeling, experiencing, processing, and they are kind of like mirrors for that. They each have their unique way of doing this, but the way they are able to hold us accountable with love for what we're carrying physically and emotionally is one of the reasons why they're so effective. So now that we know unequivocally from a scientific perspective that trauma is as physical as it is emotional, that the body holds it um, out of necessity, because when the trauma occurred, there wasn't an opportunity in a safe setting to release the trauma. The classic analogy of this that I love is if a deer is chased by a predator in the wild and the deer gets free of that danger, it will likely go through a process of releasing the trauma that involves intense shaking, even to the point that it almost looks like a seizure sometimes, of this like processing the fear, the life or death scenario that it just escaped. And usually within a few minutes, then the deer is back to grazing, getting food, acting as if nothing occurred. That is because he or she has an opportunity to release the trauma, gets into a place of safety, lets it go. Most of us, especially as humans, and especially childhood trauma, when we go through something traumatic, we never have that opportunity to let it go. We stay in the place of having it be contracted and stored. And so we hold on to it, not intentionally, but as if it is continuing to happen. And so plant medicines, ayahuasca, ibogaine, and mushrooms, sometimes iboga, like all kinds of different entheogens, are so incredible at releasing and removing and starting to allow us to close that trauma loop. The good news about trauma is it's never too late to close the loops. It's never too late to create the safety needed to get to finish processing the fear and the sadness and the rage or whatever it is that was ignited as a result of either a single incident or many incidents that just can compound on themselves. It's never too late to get to move through and release this trauma. And so enter plant medicines as not the only avenue, but certainly in some ways the fastest track, which means that it also comes with a level of intensity. If we choose to work with plant medicines with trauma, we need to have some level of foundation and resources to work with the potential that the plant medicines are going to for a period of time potentially make things harder rather than easier because they're going to open up those trauma loops. They're going to give us an opportunity to release what we've been carrying and to reframe the experiences that we've had. But they don't take it away. They don't just wipe the slate clean. They give us a safe space to finish what was started. And so it's a fast and intense process. It's not the only way to heal trauma, but man, for some traumas that we're dealing with, it is these medicines are sometimes the only hope. We'll speak specifically about addiction and Ibogaine here in a little bit. But I want to talk, well, first of all, Laura, pass it to you. Is there anything I missed about the description of trauma that you want to bring in?
Just that trauma, I mean, it tends to be loops and cycles that we live over and over again. And with working with plant medicines, I mean, I think that's what it really helps us do is look at it from a different vantage point so that we can reframe and have a different perspective on it so the same emotional triggers aren't there. I mean, EMDR also does that, right? It just helps you reframe in a way that you revisit to reframe, to rewrite the story, right? Because ultimately it becomes a pattern, and then we just keep reinforcing the pattern and that loop, right? And so, like with EMDR, I mean, I personally absolutely love, that therapy because, you do continue to go over and over it until, you're able to reframe so you don't have the same emotional attachment. And in terms of, what we see with Ibogaine treatment, I mean, that's basically what it does as well, is you get this different perspective on the trauma. It's like watching it from, a 3,000-foot aerial view. And I feel that's what also, EMDR can do too, right? It's different, right? But it's kind of comes down to that neuro reprogramming as well, right? And to help you rewrite your story and reframe the narrative so that the triggers aren't there, right? It doesn't mean that the trauma necessarily goes away, but it becomes you're processing it in a different way so that it's not continuing to hurt you and to live in the body and that you can look at it from a different point of view.
Yeah, absolutely. Essential. What you're describing reminds me of an experience I had with ayahuasca early on, revisiting a childhood trauma. But what she did in that instance is, in addition to being safe to feel and process what I went through as a little kid, she took in the memory of the experience, she replaced me, little me, with a doll in the vision. And it was so masterful because as I watched the experience happen, what it did is finally give me distance from it. And that's kind of it's a unique and effective way, an example of how these medicines can help us to, it's not like we forget these events. Of course, we'll always remember them. It's just, it releases that feeling as though it's still happening, that we're still in danger. And as Laura is saying, it reframes it. Like we know these medicines, even on the level of our brains, they rewire the neural pathways that create the experience of memory for these traumatic events so that we remember them without being triggered. We can go, oh yeah, I went through that without feeling as though when we remember it, it's still happening now. That's the magic of these medicines, is to finally give us an opportunity of letting go the imprint of those traumas and to literally rewire our brains to process them in the way they should be, of like, oh yeah, I remember that happened, but I'm okay now. I'm safe now. And it no longer feels as though it's looping in the present moment. Laura mentioned that trauma is loops. And what happens with most of us is the loops don't get a chance to complete themselves. Plant medicines can help complete that loop, which means they're not easy and it can be really intense. And that's why it's really important that we be in places that are safe and experienced to hold us through that. Not just the ceremony or the treatment itself, but also the integration, the aftermath. Because people dealing with trauma often need a lot of extra support and integration to finish closing the loops. Because it's not to say that, a dose of Ibogaine or ayahuasca is going to close all the loops like that. It could take some time, and so we typically need a lot of support. That said, it's just really encouraging that it is possible. Okay, so we're going to talk about two in particular. I'm going to talk about ayahuasca and the way that she operates in terms of helping us with trauma. Ayahuasca is a very unique entheogen because she has a couple of very potent qualities in terms of how she works with our consciousness. Number one, I mean, she's a psychedelic plant, one of the strongest in the planet. Actually, it's a brew. It's two plants. It's the ayahuasca vine and the DMT containing plant. In my tradition, we work with one called chacruna. And that brew creates obviously a very multidimensional, expanded, altered space. Definitely not from around these parts in terms of being a 3D energy. And that's one of the ways, in that expanded place, we can view and see ourselves differently. But what makes ayahuasca really unique is that she's also deeply personal, really connected to the body, ridiculously somatic. I mean, one of the core symbols for ayahuasca is the snake, because of the movement of how she impacts the body on a somatic level. And so we know with ayahuasca, it's common to purge. It's common that the purging might be vomiting, it might be crying, it might be laughing, pooping, phlegm, itchiness, yawning. I mean, there's all kinds of ways that she moves energy, but each and every one of those ways of moving energy is an opportunity of releasing a stored trauma. Sometimes traumas are physical, literally toxicity that is built up. We can purge that out or other ends. Sometimes, often the trauma is stored as grief in our lungs, in our chest. I know I used to be severely asthmatic when I started drinking ayahuasca, and I cried and cried and cried through so many ceremonies. And one day I realized I could breathe. My lungs were clear. Like all this grief, not just my own, but generational grief, especially on my mother's side. One day I realized I wasn't asthmatic anymore. And I was asthmatic since childhood, like born with an underdeveloped respiratory system, and now I don't have that issue anymore. And I'm convinced it's because ayahuasca allowed me and helped me to purge through tears the intense grief that I'd been carrying since birth, my mother's grief, really. So it's just incredible how somatic ayahuasca is. And she's unique in that way. Most medicines aren't so deeply personal. They're cosmic, but they aren't so connected to the body. And so that's one of the ways that ayahuasca is unique in helping with trauma. Obviously, she's really magical at helping us access our inner awareness, our ability to kind of see things from that higher perspective that Laura mentioned. When we're dealing with trauma, we're usually so identified with it that we can't look at it from any other perspective. And so ayahuasca can help give us a 30,000-foot view and to see it differently. And in that awareness, oftentimes we also can understand, as crazy as it sounds sometimes, why our souls chose to have these experiences. Ayahuasca has taught me there are no accidents, and even the really difficult and painful things that we go through are a part of the soul's commitment to growth. And so sometimes in that higher perspective, we can kind of see like, wow, yeah, I can see why I needed to go through that. And she helps us to also realize the awesome things that have come as a result of going through something difficult, which is part of the way that reframe can occur. Typically we find what we're made of. We have more compassion and more awareness of our strength. All kinds of things can be the silver lining of going through a trauma. That there's always like some gold that we can mine as a result of it. And ayahuasca is incredible at helping us to just have awareness around that. And she helps release repressed emotions, that grief I was speaking of, or rage, or all the things that we sometimes contract around because it wasn't safe to feel them when the thing happened or the many things happened. And so in a safe environment of taking ayahuasca, then we can finally feel and release, not recycle, but like let go. I always think of it as like a faucet, like the trauma's been held, and ayahuasca can finally unscrew that enough where at least some of what we've been carrying can be let go. And we can leave the ceremony without feeling like we're carrying that emotional baggage anymore. She also activates our self-healing capacity. She helps to stimulate our brain's neuroplasticity and, our body's miraculous ability to heal. Because again, trauma, if you think of it as a lockdown, contracted state, when that's loosened up, the body can start to move in a natural way again. Sometimes circulation improves, the breathing that I mentioned, neuroplasticity, this like movement of the brain, which is actually its healthy state that trauma can create rigidity around. So, this movement that this medicine helps to facilitate is the long sort of standing like after effects that are so incredible that we're finally in more of a fluid and natural state again. Our systems can get back to movement, which means that our self-healing capacity is reawakened. Our bodies are amazing and powerful. They're meant to heal. But when we go through things that create that rigidity, then often those abilities are thwarted. And ayahuasca can wake all that back up. And lastly, the spiritual and existential connection properties that she has. Sometimes the healing that we experience with the medicine, it isn't really about a curing of something or a releasing of something, it's acceptance. Sometimes she just gets us into that genuine space of like, okay, this has been my life. This is what's happened. It's okay. I'm okay with that. I accept my journey. And that is one of the most healing things we can experience. That, along with feeling not alone, feeling spiritually connected, knowing that all humans go through their rites of passage with trauma, and remembering that it's not a flaw, that we aren't broken because of what we've been through. Just the opposite. We're badasses. And Aya is so good at bringing this back into our awareness of, it's a privilege to go through easy and difficult things. It's a privilege to be alive. And so that reframing and that spiritual connection is also really deliciously healing. So those are some of the ways in which ayahuasca is a powerhouse for healing. Laura, talk a bit about Ibogaine. What makes, first of all, Ibogaine different from ayahuasca? Because we know it is vastly different. So can you talk a little bit about the origins and what Ibogaine is as a medicine?
Yeah, I mean, I think Ibogaine's very different in almost every way, right? Ayahuasca tends to be like very cosmic, and Ibogaine is more your personal narrative coming through, different than Aya, because obviously there's not the DMT component, right? But Ibogaine is one of the alkaloids from the iboga shrub. It's also found in Volcanga, and so when you take Ibogaine, it's basically comes in two phases. The first like 4 to 6 hours tends to be a visionary experience. However, not everybody has visions, but most people do. And regarding, the visions with trauma, so the visions are very different than ayahuasca because it's more of like your personal narrative. So this medicine helps you connect past, present, and future. So it tends to be like visions from your past, vignettes coming up, maybe like, lineage work. but it's basically helps you look at all these different life events and draw the clear line through how and why things have unfolded in a specific way. So, I mean, Kat, we talk about this a lot, but I think for trauma, like specifically, I feel like Ibogaine even gets deeper than with ayahuasca because it's such your personal story, where ayahuasca can be very non-linear, very abstract, right? Like the medicine of Ibogaine is very clear, very direct. You know, we consider it almost like the hammer of truth, right? With Iboga. And so it's very personalized to your specific story. It's not like, you know, unicorns and rainbows coming through. Like it's very clear and direct medicine. And then, so the first 4 to 6 hours tends to be this visionary experience where you can relive certain aspects of your life. And then it goes into what we call like an introspection process. And this can last up to, you know, 6 to like 24 hours. And it's basically helps you like draw the clear line of how and why things have unfolded. So from the patient perspective, it feels like it's sorting out the internal filing cabinets of your mind. So you're able to have these aha moments of how and why things have unfolded and really to take practical steps of how to step out of these loops, these cycles, these patterns, these behaviors, because left unaddressed, you continue to stay in these structures, right? It's kind of what we were talking about at the beginning of the call, where you have this like complete reframe on aspects of your life. And so in terms of resetting, you know, those structures, I mean, I think Ibogaine's in a league of its own with that. Yeah.
Yeah, well, having had experience with both medicines, although full disclosure, I've sat with Ibogaine once and ayahuasca thousands of times. Still, I concur what Laura's sharing. I think one of the really substantial differences between these medicines is ayahuasca is deeply, deeply personal in the processing of the emotions. You go so into the experience of the trauma sometimes, which is her way of helping to process it. Ibogaine is actually classified more as a medicine that has this dissociative property that's just a little bit more removed. It's not quite as identified with the experience of the trauma. And that distance is sometimes exactly what we need because it might be the first time in our lives we felt any distance from that particular trauma. And in that sort of, I guess in a way that I would describe Ibogaine feels a little safer in the experience itself because there is this distance. For example, with Ibogaine, when you're deep in the visionary stage, if you open your eyes, you need to go to the bathroom, whatnot. Typically, the visions subside. You might still have floaters and colors and whatnot, and you close your eyes, and the story continues. Ayahuasca, you're deep in the visionary stage. You open your eyes, she laughs at you of like, haha, nice try. You know, it might get more visionary. You know, it's this deeply sort of immersion into the experience that ayahuasca has, where ibogaine has more of the airplane view. It just feels a bit more disconnected, not in terms of the insights that Laura's speaking of, but in terms of the emotionality of the experience. So, because
Can
of
I can I chime in for
that,
1 second on that? Yeah, because you're watching, it feels like you're watching a movie screen on the back of your eyelids. So you're watching from a third party perspective, so you're not emotionally attached. This is how like you have the vantage point of how and why things have unfolded. It also like it feels like you're in a very deep dreamlike state. So you're awake, but you actually can't differentiate if you're awake or asleep. So your nervous system's actually really relaxed. You're in this really deep, almost like meditative dreamlike space. And so when you're having these reflections, you're not triggered in the same way. Like with ayahuasca, when I've been deep on the medicine, it's like I can be very triggered with what I'm experiencing because it feels real in my body, in my mind, as Kat was saying. Like, you know, sometimes you open your eyes on ayahuasca and the visions are more intense. It's like, ah, you know, and with ibogaine, it is like you're not emotionally attached. So you could have severe trauma going into this experience and see this traumatic event, but there's not that emotional attachment and triggering. And so that's how you're able to really reframe that experience, right? And so I know with Ibogaine, they're using it a lot with veterans and, PTSD and severe trauma. And that's because of that, third party perspective that you're able to go back into that in a safe way. I think a piece of that too is Ibogaine is done in a medical context, right? So like during the treatment, two doctors each take a 12-hour shift. You have an IV in your arm for hydration, you have an EKG on, right? And so a lot of people feel comfortable in that setting too, right? Because it is done with medical care, right? So someone with severe trauma can feel safe in that setting, knowing that there is medical care there to help them go through that process as well.
And then there are those of us with medical trauma that might feel safer in a shamanic
Oh, yeah.
environment, right? But, like, hey, it's great that we have options. That's partly what we're celebrating today. Laura, can you speak to the process with noribogaine?
Yeah, so when you take Ibogaine, your liver converts it to an active metabolite called noribogaine. Noribogaine binds to your receptor sites and is like stored in your fat cells for this 1 to 3 month period afterwards. And noribogaine is a great antidepressant, anti-anxiety. You feel really good and in the flow of life afterwards. But noribogaine is made through the body's process of metabolizing the ibogaine. So it's absolutely fascinating. Yeah. Yeah.
Yeah, the fact that noribogaine does not exist in the alkaloidal structure of iboga or vokanga. It is created as the body, the liver processes ibogaine and then saturates those receptor sites. And noribogaine, like Laura says, it lasts 1 to 3 months physically in the body, just depending on somebody's metabolism, which is this like afterglow period that ibogaine has. That's unique, with all the medicines, that you have this window of opportunity to capitalize on the fact that the body is supported with this incredibly powerful medicine. We're proud that our mentor, Dr. Deborah Mash, was the one who discovered noribogaine and is, one of the world's authorities on this medicine. And it's the noribogaine that gives people an opportunity to really kind of create a new way of living and relating to the world in that aftermath. I think, Laura, we also have to name the effects that ibogaine has on addiction. I mean, that's why ibogaine is famous. But we're talking trauma today because underneath every addiction is a trauma. But what is it that ibogaine does for addiction that's so unique?
Yeah, I mean, to take it one step back, ultimately I think it does come down to trauma. Like addiction is what you see. Addiction is what expresses itself on the surface, right? And we all have various degrees of trauma, right? Some more intense than others, right? But addiction is how it expresses itself. And so, in my opinion, this is why, I mean, the rehab industry at large, it's the only business on planet Earth that has a 95% failure rate that's still a successful, thriving, and booming multi-billion-dollar industry. And I think a big piece that's missing in that conventional approach is that they're treating the addiction, right, and not so much the trauma. And when you're not, going into the trauma to help heal those elements and aspects, the addiction will just keep resurfacing in different ways because it's what you're seeing. It's not necessarily the underlying what is creating, this environment that I feel that I need to do the drugs every day. And full disclosure, I am a former opiate addict. I had been years on opiates, years on methadone, years on Suboxone, countless treatment centers, and nothing worked until I found Ibogaine and I got my life back from this medicine. And how Ibogaine works is it resets your neurochemistry back to a pre-addictive state. You take like an IV heroin addict, cocaine, methamphetamines, alcohol. Alcohol is slightly different, but Ibogaine blocks the withdrawal symptoms. Like within 45 minutes, your addiction is eradicated, meaning you're not sick, you're not going through withdrawal. And then Ibogaine so it eliminates the post-acute withdrawal symptoms, which is commonly referred to as PALS. PALS is the reason so many people relapse. That's the cravings and depression, where nothing makes you feel normal except doing the drug or having the drink or taking the medication. And Ibogaine fast forwards that period of time. So your brain is functioning as if you've had a few years of sobriety which gives you a solid chance to make it. And Paul's is the reason so many people relapse. So typically that relapse period is in the first 2 years, right? Because neurologically speaking, you're still, in active, not active addiction, but in the post-acute withdrawal addiction part. And so in terms of addiction interruption, Ibogaine is truly in a league of its own. And I, hands down, would not be alive today had I not found this medicine. Truly. Yeah.
Laura, hearing you describe that, which I've heard you say before, but something occurred to me that I don't think I've put together this consciously about Ibogaine and addiction and trauma, is that because Ibogaine fast forwards the post-acute withdrawal symptoms and gives people an opportunity to feel like they are sober again, then there's this opportunity to actually process the trauma
Yeah.
that the addiction has been hiding all of those years. Usually, people are in this state for a very long time. And so it's not necessarily like, oh, I instantly feel better, although people instantly feel the relief from, oh my God, thank God I'm not craving the substance. But then there's this opportunity to actually do the deer example, to close the trauma loop, to get to feel and process what the individual went through that was at least in part the reason for the self-destructive patterning.
Well, to take it one step further, I mean, that's what the experience in the medicine actually does, right? That, for me, my personal experience, that is the visionary experience. It's like looking at these life events, like getting real with yourself. I mean, this medicine is very clear, very direct, right? And it shows you, like I had one experience where, I mean, I was shooting heroin and a lot of it. And I had an experience where the Grim Reaper came in and I saw the eyes come out and stare me down. Like I was on death's door, right? And the medicine was just a direct reflection of like what I had been doing to myself, and I did revisit traumas and was able to look at that. And I remember that morning, like that I came out of treatment and it was so cathartic. Like I just cried and mourned for myself of like what I had put myself through, right? And like my inner child, like I was just devastatedly sorry for it, right? So it was this complete reframe of like, what have I been doing? And like, this ends now. And then you get the extension of the nor-Ibogaine coming in after that. And, for years, in my addiction, it felt like I was always swimming upstream, right? Everything was always so difficult, so challenging. It was like I was going against the current. And, after after taking Ibogaine, it felt like I was like in my floaty, like flowing downstream, like, and things just started opening up from there. Like this magical essence of life came through because this different awareness came through, right? And not, it wasn't me giving my power that the medicine came in and fixed me because there was a lot of work to do on myself after that. However, it gave me a different vantage point to look at my life, to look at what I had been doing to myself, my family, and to see my potential as a person. So,
Beautifully stated.
yeah.
In a moment, we're going to open it up to questions. So if anybody has anything they want us to address, please feel free to put it in chat, and or we'll open it up if you want to use your voices here in a bit. So start thinking about other things you want to talk about in this vein. Before we do that, though, Laura, a couple things. First of all, just because it's usually a question people have, will you describe the difference between iboga and ibogaine and why we use a single alkaloid rather than the plant itself?
Well, I mean, Iboga is done more like Iboga is a ceremony, right? And so Ibogaine is done in a medical setting. So I guess that's first and foremost. But Ibogaine is one of the alkaloids found in Iboga. And the reason we use Ibogaine for addiction, like trauma, PTSD, it's the nor-Ibogaine component that we were discussing before. So that when you take Ibogaine, your liver converts it to nor-Ibogaine, right? And that's what you want for these like really medicinal benefits. If you take iboga, ibogaine is one of like trace alkaloids found in iboga, so you don't get that full saturation. Um, Ibogaine also it can prolong the QT intervals of the heart, and iboga can actually do this too, right? So I don't believe that it's safe to take these medicines without proper medical care and support with emergency trained doctors that are ACLS certified and that actually know how to keep somebody safe because it is possible to do ibogaine safely, right? However, it's not taught in medical school, right? So you really have to be cautious of, who are these doctors, where are they learning, et cetera, right? So, but it's very different too. I mean, iboga, I haven't done iboga, but it's a long process and it's psychospiritual. And, with ibogaine, we actually don't treat psychospiritual. So I think that's more where ayahuasca work comes in, right? Of the psychospiritual component. So with ibogaine, it is done medically, right? Because we're treating medical conditions.
And if we just take Iboga, there isn't enough of the concentration of the
Yeah.
ibogaine to do the reset.
Yeah.
Not that Iboga doesn't have fantastic benefits, it's just for people in the deep states of trauma and or dealing with addiction. Ibogaine is the pathway to actually helping with pause and the total neurological reset. Yes.
And I think another piece, thank you for bringing that in, Kat, but like let's say with active addiction, so let's say opiate addiction, like at our Ibogaine clinic, we stabilize you on morphine up until the treatment, right? And so that's where the medical care also comes in of like there's certain medications we can and cannot give. A lot of medications do interfere with Ibogaine and need to be discontinued prior, to arrival, lots of different, all across the board from antidepressants to blood pressure medications to antibiotics to even antifungals can interfere. But there are a lot of medications that can also be given to keep somebody comfortable up until the treatment. And, with Iboga, yeah, you wouldn't have that same level of support. So in terms of like medical conditions, I think that Ibogaine is, what is needed instead of Iboga in that context.
The last thing I wanted to kind of explore is when ayahuasca is more appropriate versus ibogaine. And specifically around trauma. If somebody's in active addiction, it's kind of a no-brainer. It's ibogaine all day long, amongst all the medicines, not just Aya and ibogaine. But when it comes to dealing with PTSD and dealing with certain forms of trauma, I think really the point of measurement is the has the individual yet had an opportunity to have that distance, to have an experience of not being so personally identified with the traumas that they have been through. And if that hasn't occurred yet, without a doubt, ibogaine. And also for people like veterans that typically are going to feel safer in a medically controlled environment. Like it's really it comes down to a lot of how we define safety. Ayahuasca being psychospiritual, being shamanic, being ceremonial, being typically with other people. Ibogaine being clinical, being usually one-on-one with the facilitator is actually the doctor or nurse. And at our clinic, we also have people like myself who are shamanically trained that can hold both. But regardless, it's about what makes the individual feel safe. Do they want the one-on-one attention in a clinical space and an opportunity to have that sort of distance from the trauma? Or are they called to something communal and shamanic and to really get an opportunity to feel and process and do the deer thing of letting go of the trauma in that way? I mean, it's not a bad decision. It's just that with each individual, depending on the type of trauma they're dealing with, depending on their definition of safety, these medicines offer entirely different experiences. Is there anything you want to contribute to that, Laura, of like how does somebody who's dealing with PTSD or just any trauma related issues decide where to go?
I mean, I think ultimately it's a calling, right? Like you have to resonate and want to work with the medicine specifically. I don't think it's as simple as, follow these guidelines and this is where you go. I think it's a deep, deep calling, and I think that, all the medicines have their place, right? However, in some instances, it's, yes, Ibogaine, yes, ayahuasca, right? But it has to come down to the calling because at the end of the day, you have to want to actively participate in this, right? And so, like, that is first and foremost. So, if you feel the draw like ultimately to follow that, because it could be the best program in the world. If you aren't drawn to that medicine and you aren't drawn to doing that work, you're not going to open up fully and be receptive to it. Right. And so I think that's the biggest piece here, is to really feel like it's a good fit.
Yeah, well said. Thank you for that. The floor is open. Would any of you like to ask anything, contribute? You could raise your Zoom hand, you can unmute yourself, you can put a question in chat. You got options. We would love to hear somebody else's voice other than our own. Either that or we did a really good job of covering everything, Laura.
Hi.
Daniela.
At the beginning, you talked about ayahuasca and ibogaine being really great for trauma, and then you said psilocybin also, and that's all I've worked with, and I still have trauma. Anyway, so I was just wondering if you could talk about that.
Absolutely. Yeah. So psilocybin has a lot of the same effects that ayahuasca does, just in terms of neuroplasticity, rewiring the brain, right? All kinds of benefits for the nervous system. Psilocybin isn't as somatic as ayahuasca is and doesn't have the same capacity to move energy the way she does. So sometimes if our trauma is really stored in the body, outside of just not that it's a small thing, but the mind and the nervous system, ayahuasca can be the thing that gets things moving again, right? That snake-like energy that she has. But it's really important to mention that no matter what medicines that we're working with, it's a process, right? No matter how effective they are. Psilocybin can get to some root things that might take time, even just working with them layer upon layer. I mean, working with ayahuasca, it took me years to get to the core of my bulimia. I was severely bulimic when I made my way to the medicine. I dealt with alcoholism pretty early on and some trauma related to that. But the trauma around bulimia was so deep that it took a long time to get to those particular programmings and traumas. And so there's a lot of things at play. Might be that there's another medicine that's more appropriate for the kind of trauma we're working with. It might be that the trauma, a lot of us are doing healing on the level of our lineages, our families. And that is a long, deep process. No matter how powerful these medicines are, they fast track it, but it doesn't take away from the fact that it's layer upon layer upon layer. So psilocybin, I think is amazing for our brain health. But when it comes to knowing that there's stored toxicities and whatnot in our physical bodies, I think ayahuasca has better capacity. Not that they're not that the mushroom friends don't have it. It's just not their superpower in the same way. Yeah. Laura, please.
Yeah, and I also think, well, I mean, a few things here. So I think mushrooms tend to be more abstract, right? It's not as personal, right? It's not like helping to rewrite the personal narrative in the same way. In my experience, it's more of external, right? Instead of like that deep internal reframe. And then Kat, we've seen this a lot, between plant medicine people and Bosse. I feel like Ibogaine kind of fast tracks it, like it like goes right into it, right? Where ayahuasca, it can take multiple ceremonies to like, or even years to get to the core of what that is. With ayahuasca, she really comes in, and we like to say she heals in order of priority, right? And so it could take a long time to get to that exact place where that trauma is, right? Ibogaine tends to come in, kind of kicks in the door. Yeah, and it's like, this is what this is, right? So they're different, right? But it's interesting too, right? We talk about the feminine and masculine qualities, right? And ayahuasca is so feminine, and ibogaine, it could be masculine and feminine, right? It's both, right? But the reason I bring that up is like it does feel in the way that it comes for, the trauma, or it does feel more masculine in the fact that it's like, okay, we're going here, right? Opposed to more around and about. And mushrooms tend to just, in my experience, be more playful, and it's less concrete, it's more abstract and leaves you questioning, instead of having like this deeply personalized experience that you're like, wow, this is why everything has unfolded in a specific way, and here are the steps to go out and change that. Does that make sense?
Yeah, I do appreciate Ibogaine is such a straight shooter in communication. And then mushrooms and ayahuasca, they work with trickster energy. They come in the back door and they communicate through the subconscious. And I love that too. Don't get me wrong. But deciphering the trauma, it's helpful the way that Ibogaine is such a direct communication. It isn't metaphoric. So yeah. But Daniela, did that address what you wanted to ask?
Yes, except my name isn't Daniela. I think there is a Daniela who is on the on the
Interesting.
call.
It says that's your name. Yeah. What is your
Hi,
name?
I'm Heather. Yeah,
Heather.
I answered it. I guess I'm afraid to take ayahuasca because I all I hear is like people barfing and pooping, and not everyone does though. But
Part of
I
that's getting rid
would
of the
like to
trauma.
work with.
And ironically, with ayahuasca, like it's not that common that we lose control in that way, but it's a common fear, because she does address the fear of losing control. Yeah, and it's really that sense of control that is often the thing that needs to be let go in order for the trauma to be let go, because that control came from a place of defensiveness, protectiveness, survival. Oh, I have to survive this, so I have to control it, and the mind just takes over. And at the time that we went through the trauma, that was the reason why we survived it, but it doesn't serve us long term. And so ayahuasca is really good at like how about you not be in control? And that could be the worst case scenario to the mind, but the best case scenario in terms of getting to let go of the trauma. That's why it's important to be with somebody who's well equipped to create a safe container because you just never know.
But that's also like the deer shaking out the trauma, right? Like when you purge and have that release, that's what that is. You're letting out these stuck emotions so that it's not staying inside of you and, festering internally, right? Like you want those releases because that's the energy moving that is the release of trauma, stuck emotions, patterns. So, I mean, that's, in my opinion, that's one of the magic parts of IO. I love the purge, right? Because it's out, it's coming out, right? Instead of like staying stagnant inside me and, trapped. We also, really quick, we have Suzanne who cannot read. Okay. All right.
Yeah. Suzanne is next. And
Okay.
then Randy. Suzanne, please.
Hi, hello. Um, Thank you both for doing this and doing this work. I don't know, can you see me or hear me okay? Like, can
We
you?
can't see you, but we can hear you fine. So
Oh,
totally.
okay. Let me turn on my video too. It's weird, I don't show up as a participant, so I can't
Your
like,
name too says it's Daniela. I don't know why Daniela is
I
multiplied, but
know.
hi,
Okay,
Suzanne.
hi, can you see me now?
Perfectly.
Okay, I can't see me, so it's weird. But anyway, hello. Um, okay, so I have a question around, I don't, so I'm, it's not so much that I'm afraid of certain medicines, but I sort of would love to know if I had a journey with psilocybin, and I set intentions for that journey, to go to the traumas, and and that's where I made the offerings, and that's where my focus was. It wasn't like, hey, I want to like take this and like have a great time at the concert. Like it was not that at all for me. Not that I'm in any way judging that, but like I set a pretty firm intention, and the I did the journey, and like before I could finish the cup of tea, it was like I was like shot in. It was so intense. I mean, like I needed help getting over to the bed where um, I laid the rest of the time. It was so visual. I went, and the person who I did it with, who in some ways was very supportive and helpful, I believe. Um, but I also wish I had had other support. She said that she had never seen someone like shoot in that quickly. And so it did freak me out a little bit. And I'm just wondering if like, and she was like, I think you're just really, really sensitive, and that's okay. But does that mean that I'm going to probably be sensitive to all the other medicines? Like, do you think that's indicative? And then also like, I would love as a follow-up how you decide when you've had so much trauma that your compass is kind of broken, how you decide if someone's safe to go on the journey with. Because I felt like this person was safe, but then like she literally left me and like went somewhere else after I was done. And I was sort of in that liminal state where I was like, I didn't feel safe to get in an Uber. I didn't feel safe to leave. But then I was in this like strange place by myself. And she's like, take your time. I'm right down the street if you need anything. And I was like, why are you leaving? Like, why would you leave someone, you know? So I'd love to know, like, I'm not afraid of the medicines. They're so beautiful. I'm afraid to not have the support I need. Sorry.
You're perfect. Thank you for being vulnerable. And your questions are really important because those of us who've experienced severe trauma, we don't have a sense of safety and our compass is off because it's damaged and wounded, right? So, first of all, your question around sensitivity. It might be that you're sensitive to all of the medicines. It's a good thing to know that, wow, that was really sensitive. So, if and when you work with other medicines, you work with someone who will titrate with you. Start with a small amount. You could always do more, you can't do less. So to be that one of the ways you're going to define safety if you sit again is with somebody that supports and celebrates titration. Which is something I'm so passionate about, especially since COVID, since this, we're living in such shadowy, intense times. We're all more sensitive than we were 5 years ago. And so to honor that sensitivity. So that's one of the ways you'll define sensitivity going forward, right? Because we don't know. It could be that you need lots of ayahuasca and but one of the things, Suzanne, that's really telling about that experience that you shared is your intention was to go into the trauma. That could have been one of the reasons why, boom, like it happened so fast because you came with such courage of let's do this. And the medicine said, okay, here we go, and I hope in some way that it helped, even though you weren't necessarily in the safest container because you shouldn't have been left alone. You should not have been left alone. And that'll be something you'll make sure next time is somebody there all night long? If I should need it, because we should be. As a facilitator, it's my responsibility to make sure everyone's safe and back in their bodies before I take off. And that's the just part of the responsibility. It has to be that way. So, how do you know that someone's safe? Well, you want to trust other people that have sat with them that have also been traumatized and that have felt better as a result, right? Going on Reddit and reading those threads is not necessarily appropriate. It's like having a personal reference with someone that's like, yeah, I felt safe and I was doing work around trauma and I had someone that was there for me. It's easier to trust somebody that we can relate to their experience than it is some slick description or Reddit thread or whatnot, like having a personal recommendation, if at all possible. Because until we've had the opportunity to heal some of our trauma, we can't really trust our instincts because they're coming from a place of woundedness. And that's one of the challenges. The other thing I would say is sitting with people that also are very transparent and vocal about the traumas that they've been through. And just kind of feeling that there's a sense of compassion and empathy. Sometimes we feel better sitting with people that directly understand our traumas. I am a woman who's gone through sexual abuse. I create good safe space for people who've done that. I am a part of the queer community. I'm super safe for people in that. I am a white woman. I might not be safe for someone dealing with racism because I can't directly relate. I care deeply, but I don't know what it feels like. So that's one of the ways that we measure safety too, is like it's not always the case that we need that, but it helps me to know, oh, this person gets it in their own way. So that can be another thing that will help you be more discerning, if you sit again with someone that you get to be in safe hands.
Thank you. That's really helpful. And I had seen someone who seemed reputable and asked for recommendations from her. Um, and so I thought this person, and then they had said, I won't leave until you're fully ready, but their words weren't congruent with their actions. And it was sort of like I was like, oh, this is the story that gets played out in my life, because it ended up being there was a little dog in the house, and she came and laid with me, and I was like, okay, I have everything I need. I'm safe. I figured out a way to feel safe and calmed myself. But I was like, oh, this is the story. Like I'm always doing it. Like I'm always doing the thing that, yeah, it was just a really interesting experience. I was like, you said you weren't going to leave, and then you just left. Like when it was like when the 5 hours was up, she just left. And I was like, wait, I paid you, I paid you the amount you asked, and you said you were going to stay. And so that shouldn't have happened, right? Okay.
Correct. Yeah.
Okay.
And
Okay.
look, it's like you tried to vet them well, and it just sometimes we just get surprised that people don't follow through with what we were trusting them to do. And at least you have the doggy, and
I
yeah,
know.
we're in the situation you're so used to of I'm self-soothing, I'm taking care of myself. Yeah.
Thank you so much. I really appreciate it. Thank
Thank you for sharing.
you.
Randy, you were up next.
Hi, Kat. Nice to see you again. Um, I was just going to comment on, and I see Heather's got her hand up again. I just wanted to share uh, what Heather was talking about with psilocybin, and I wanted to share how psilocybin actually led me to ayahuasca in a way that with the PTSD and the past trauma that I was dealing with, and I you know, 68 years of baggage to open up, basically. But um, what the psilocybin did at the start was it was a very beautiful trip to, I'll say, a closet that had the skeletons in it. And it was beautiful all the way to there. And I had beautiful journeys with psilocybin until I didn't. And then that's when I'll say, the closet door opened and fear came in. And I got so terrified with on psilocybin journeys after that. And what I see in after thought now is how psilocybin led me to those traumas and showed me them, and they scared the hell out of me. But that's as far as I ever got. And then where psilocybin led me to me with ayahuasca, and it just, I say led me to it because it just kind of came out of nowhere, and I met this beautiful person, facilitator. It just kind of happened. And I did a few ayahuasca ceremonies, and the difference with the psilocybin and the ayahuasca was I'd already been taken with psilocybin to where those those issues resided. I'll call it the closet. And it was ayahuasca that opened the door and let things out of the closet. And yes, it was terrifying, and yes, it was extremely hard work, but it was also very beautiful and ended up so beautiful and peaceful and um, lightning and enlightening at the same time. And since then, I mean, I know there's a lot of work to do. It's lifelong work for sure. But since the ayahuasca, psilocybin, I've gone back to that nice, beautiful relationship where I go to the closet and it's open, but it's not so scary anymore. And I have the ease and comfort and confidence to work with it. So since the ayahuasca ceremonies, I still do mushroom ceremonies occasionally slash regularly, and they have changed significantly since ayahuasca. The psilocybin now seems to wake up the ayahuasca in me, and she starts to circulate again. And the psilocybin journey can be much like the ayahuasca, and I revisit the journeys, and it's beautiful that way. But it was a process from one to the other, back to the one again, and it was just such a beautiful journey. I just wanted to share that.
Randy, that's absolutely lovely how you describe the sort of interplay with the medicines, how they work with each other. These remarkably conscious beings that kind of know to pass us off. Like, here, go see Mama Aya. She'll help you with this. And then, oh, come back to me and I'll help with the next phase. And just the vast intelligence of these beings. And for those of us that are lucky enough to work with multiple medicines, that interplay is really magical. So thank you for describing that because, we get to a certain point with one and sometimes they pass the baton and then we get to work with another. And what you're describing too with ayahuasca kind of coming into the mushroom space, she does that. Like once we develop a relationship, I've heard people work with ganja and all of a sudden it's an ayahuasca ceremony. Yeah,
Yeah,
I will take any open portal sometimes if there's unfinished business. And just that interplay is so fascinating and so spiritually affirming of how just wise and powerful that they are. So thank you for sharing that.
yeah, ganja as well. And yeah, once the medicine, and I was told this right at the start, once ayahuasca resides in you, she's always with you, and that's been so true. And yeah, with ganja too, it's really changed the relationship. Yeah,
Awesome. Thank you so much, Randy.
thank you.
Heather, back to you.
Hi, thanks, Randy, for that. Yeah, I've had terrifying mushroom journeys, and I had to make a deal with mushrooms that I said I can no longer do these kinds of journeys with you. But anyway, I wanted to speak to having a sitter, and for me, I can tolerate a large amount of mushrooms or medicine, but it lasts a very long time. And so quite often I've been in ceremonies and they would end it like pretty much like that. And I would still be deep in the medicine. And then they'd be like, let's go in the circle or let's go eat. And then I would still not be able to finish my journey. And then even in March, I had a one-on-one sitting with someone and I said, I am in the medicine for a long time. And she cut it really just doop, 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 like that. And I did have a friend come pick me up and we went back to the hotel. And I was still in the medicine and I needed support. But I didn't. So that was like a difficult situation. So yeah.
Yeah, I'm sorry to hear that you two have been not held in a container that gave you the space to actually finish the experience that you had. I mean, this is one of the reasons why I like doing things in a retreat container now. I used to do weekend warrior kind of sessions and it felt too rushed regardless. Whereas the retreat, gives us the space to um, journey all night if that's what the medicines want. I mean, because the way I look at it, it is such a privilege to be in that portal with them. And so if they want to be chatty all night long as a facilitator, I get to hold the space because that's the whole dang point, and if it's long, too bad. Like that's what we sign up for. I think of it as I'm a pilot of a spaceship. And if the pilot gets tired because there's been a long journey, it doesn't mean the pilot gets to leave the cockpit. No, it needs to be landed safely. So I look at it that way as the commitment to we're not going to stop until everyone feels that they are grounded back in. So maybe this is a lesson for all of us to make sure that we are vetting the people we sit with in that way. Yeah, Laura.
Yeah, I think that's what I want to bring in here, right? Is, you're really in the medicine space. I mean, I guess we'll start with mushrooms, right? Because there's a much bigger push in the United States right now with that. But there's a lot of unqualified providers out there. We see this in every space with all of the medicines, right? Mushrooms is just obviously more prevalent right now because a lot of states have different laws regarding it, right? And, with mushrooms, there's not like the lineage, right? Where with ayahuasca or the same training. And now people are out getting their certificates. We see this with ketamine too, right? And it's, people that don't necessarily even have a relationship with the medicine are then getting certified and then administering it, right? And so we see this in ayahuasca, right? Where there's, questionable practitioners. We see with ketamine that a lot of medical trauma is happening too, because they're not actually holding space for the participants, right? It's reinforcing the medical trauma, not actually happening in a lot of situations. We see this with Ibogaine, with doctors administering Ibogaine. I think that's like also, with Bosse, like me and Kat's clinic, our medical staff is trauma trained, trauma informed. We've got them in monthly book clubs, like studying trauma, Gabor Mate. How do we actually hold space? They're all in Kat's integration course, learning how to actually apply shamanic knowledge, holding space to their medical degrees. And I think one of the biggest traumas we're seeing in this space right now is a lot of Ibogaine clinics out there actually combining 5-MeO DMT 2 days after Ibogaine. And that is absolutely unethical, unsafe, and not okay as far as we are concerned, because a lot of people go to these Ibogaine clinics not even knowing that they're signing up for 5-MeO. And then it's like the psychedelic all you can eat buffet for $2,000 more. You can also do 5-MeO, and then the group is doing it. It becomes peer pressure, throwing people into really existential crises. But we see this across the board with all the medicines. And Kat, I mean, we talk about this all the time. This is heartbreaking, right? Because these medicines have such the potential and power to help us heal, right? And there's a lot of bad actors out there, and it's really hard to know how to trust and know who's doing a good job in this space. And I mean, this is like the ongoing debate in our home, right? But it's heartbreaking to watch because people deserve better, right? And to know that they can do this in a safe container and that these medicines do truly want the best for them. And yeah, I mean, I'll let you take it from here. I had to take that opportunity with the topic of trauma to really talk about these medicines don't just help heal trauma, the medicines can actually inflict trauma in the wrong hands.
It's absolutely accurate. I mean, anything that has the power to heal us in this way could have the power to traumatize us in the wrong hands. And Laura, what you're pointing to just around the mixing of the medicines is really important for all of us, like looking to heal from traumatic experiences. Some medicines are traditionally used together, but most are not. And so when you encounter, the weekend where it's psilocybin and ayahuasca and combo and bufo and ketamine and like all of the things, please, please, please stay far away. Because just because they can all be thrown together doesn't mean they should. And a lot of times, even some of those medicines, like Laura is naming, are physically dangerous and have actually, even in rare cases, killed people to combine the two because there's just no reason to do, multiple medicines in a short period of time. It just disrespects not only the medicines themselves, but us as human beings that have a limited capacity to deal with intensity. And if we're trying to heal from trauma, trauma is a state of overwhelm, is an experience where we have been sent beyond what we felt our capacity was to hold. And so doing multiple medicines in a short period of time can increase the likelihood that we're re-traumatized rather than healing. And like Laura said, it's heartbreaking. It's the absolute opposite of what we're hoping to achieve with working with these medicines. So being discerning about that too. The all-you-can-eat buffet is not the goal here. That's a good way to put it.
And people can have good intentions, right? But it also comes down to training and being able to hold that for somebody else, right? It's like, what is the saying? The road to hell is paved with good
Good
intentions.
intentions.
And
That's
it's
right.
like, making sure that people are actually experienced and qualified. I mean, especially we're in the midst of the psychedelic renaissance here, right? And I think that's my biggest concern with, the United States and all the different like ketamine clinics, psilocybin, Ibogaine's in the news, right? It's It's how is this done, right? Who is actually administering it? What are their intentions like, and their experience? I think that just, is everything because, yeah, you can have good intentions, but, when your 5 hours is up, they leave. It's just, you have to really know that the person's going to be able to hold space for, every way that that can go. So.
Yeah, home ketamine programs now too. Like there, yeah,
There
there's
was a
just
death recently around that.
yeah, there's just recklessness because it's expanded so fast, this world of entheogens, that there's just there's a lot of immaturity,
Well, because
basically.
it's capitalism. It comes down then that that's the drive, that's the play, right? That's the inexperience. Everybody's got their certification as a ketamine facilitator, as a psilocybin facilitator now, right? And so, what I'm seeing personally is a lot of profits over people with, what is out there right now. And, we need to take a step back from that and really, it's people over profits. And really doing this the right way. Because if this continues on this trajectory, it's just going to shut down the industries entirely, in my opinion, right? We'll go back to prohibition in every way, shape, and form, right? That's my fear. And so like to really like do this in the right way, I mean, that's the only way that this can be done, you know, in in my opinion. And no reciprocity. Yeah.
I was just gonna thank you for putting that in chat. Yeah, another way to trust that there is integrity with the people that you sit with is to have tangible evidence that there is reciprocity. A lot of people talk about it. There's very, in my experience anyway, the very little execution of it. That's actually like, who are your nonprofit partners? Are you putting plants back in the ground? Like, not just saying it's important, like, are you doing it? Because if there's integrity around respecting the medicines in that way, there's likely to be integrity around respecting human beings too. They go together, and so these are the sort of things that we ensure in terms of vetting the people that we sit with, that there's integrity and that there's compassion, and that, as Laura said, it's people first. It's people first and plants. Well, thank you everyone for the shares and the presence and the interest in this. We really appreciate, your questions and your contributions. Basse is the name of the clinic that Laura runs for Ibogaine, and Plant Medicine People is our company with ayahuasca. If you ever feel called to work with any of these medicines, you are most welcome with us. We do our best to create safety, although I will say we're not safe for everyone because no one can be. That's not physically possible, but it is our priority in everything that we do. And especially when it comes to creating safety for people who have experienced the depths of unsafety in this world, through trauma. So thank you so much. We wish you a happy rest of your weekend. And yeah, hope to see you again soon. Be well out there.
Bye. Thank you.